On this Thursday night, vaccine drills before Canadians get the shot. Ottawa's plan to rehearse the rollout.
Everyone will be ready, everyone will be comfortable, the people will be trained.
And Canada could approve the first vaccines by mid-December. A blunt message from Manitoba's premier to pandemic deniers.
If you don't think that COVID's real, you're an idiot.
Plus, Quebec's U-turn on Christmas gatherings. Global News investigates the spread of COVID-19 lies, the three countries targeting Canadians with falsehoods. And tunnel vision.
I think we'd all be horrified if things went ahead causing damage to those sites.
The controversial proposal merging with a prehistoric monument.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with new information about COVID-19 vaccines and Canada's plan to roll out the largest mass vaccination program in Canadian history. Health Canada could approve the first vaccine in 7 to 10 days. It's likely to be the Pfizer BioNTech vaccine. The first doses, enough to inoculate 3 million Canadians, could arrive from Pfizer in early January or sooner. That vaccine must be kept ultra cold, so Pfizer will deliver it directly to 14 locations across Canada where special freezers will be in place to store it. The government says it hopes to have those sites up and running by December 14th. Canada's Deputy Chief Public Health Officer says naming an exact date of when the first doses will be delivered is less important than being ready.
We shouldn't be so obsessed about the, quote, actual delivery of the vaccines themselves, the dates and so on. I think what's really important is the fact that we're planning, preparing, doing exercise so that once the vaccine actually technically arrives, then everyone will be ready.
Approving the vaccines is the role of Health Canada, as is deciding how many doses each region gets. It's expected they will be distributed on a per capita basis. It will be up to the provinces and the territories to actually administer the vaccines. Abigail Bimman explains what we know about the plans and what is still uncertain.
I kind of like the idea of being ready before the Christmas time frame, so that we're certain to be ready when it comes in January.
While none of the 4 vaccines under review has been approved, officials believe Pfizer will be first. That manufacturer will deliver the product directly to locations across the country. There are 14 being set up, and the Major General leading logistics says the goal is to have all 14 ready to go by December 14. There's a dry run happening Monday.
They execute the process of handling and ensuring that people are comfortable with this very unique requirements of handling a ultra-low temperature vaccine.
As for vaccine approvals,
we expect a decision soon, and certainly we expect it to be a favorable one. But in the meantime, we're not just sitting still and sitting on our hands.
Health Canada says it's still waiting on some key information from manufacturers, which could come as soon as Friday.
Part of that information is really around the manufacturing process and which specific lots may be destined for Canada. And it's really important that we get that information and we have good information about the quality assurance checks on those.
The military will be involved in the rollout, and a planning directive obtained by Global News says in order for the supply chain to be set and ready for delivery before the new year, they need vaccine approvals, the number of doses per province, and guidance about who gets the vaccine first. The chief of the defense staff calling for that by no later than early December. The government hasn't announced any of that, and it's December 3rd.
In the absence of clear answers in certain things, we always make assumptions and work on those assumptions and work to turn assumptions into facts.
The government is planning for 205 vaccine delivery points across the country, with provinces and territories deciding the specifics. Abigail Bimman, Global News, Ottawa.
Canada is following the same timeline and getting the same data for vaccine approval as the U.S. And today, America's top infectious disease doctor, Anthony Fauci, said the U.K., which approved the Pfizer vaccine yesterday, rushed the approval process. And that, he said, could fuel vaccine skepticism.
I love the Brits. They're great. They're good scientists. But they just took the data from the Pfizer company, and instead of scrutinizing it really, really carefully, they said, okay, let's approve it. That's it. The FDA, the United States of America Food and Drug Administration, is the gold standard of regulation. They're doing it in a very careful way, appropriately, because if we did anything that was cutting corners and rushing, we have enough problem with people being skeptical about taking a vaccine anyway.
Fauci later said he didn't mean to imply the UK used sloppy practices, just that getting the vaccines is not a race and being first is not as important as being safe and prepared. Well, there are no vaccines approved yet, of course, and even if and when they are, it will take months for everyone in Canada to get it. Right now, there is still a crisis unfolding, especially in Alberta. Today, that province broke another daily record. More than 1,800 new cases reported, and 14 more Albertans have died. The test positivity rate there is now 9.5%. And because Premier Kenney has put in only modest restrictions, it's expected the virus will keep spreading virtually unchecked. Now contingency plans are being made to build field hospitals to hold the sick and dying. Heather Urix-West reports.
They have come to be a symbol of the COVID-19 pandemic. Field hospitals erected in a hurry after existing hospitals are overwhelmed. Alberta may not be there yet, but the province has asked both the Red Cross and the federal government for help should that time come.
This is, conversations about a contingency plan, which health officials should be doing, both those in the ministry and those in AHS.
Alberta's former chief medical officer of health says while it's prudent to prepare for what's to come, preventing these worst-case scenarios should be the priority. And so far, he says, Alberta has not done what it needs to in order to bend the curve.
The window is closing. That's what happens with exponential growth. You cannot. Alberta Health Services personnel and the planning they've done have been first rate. I mean, the performance has been first rate. But no system can deal with 2, 4, 8, 16, 32 times as many cases as they had before.
We've seen that positivity rate bounce around between 7 and 9% over the past week or 10 days.
In fact, Alberta's test positivity rate has been steadily rising from 1% in early October, 5% by November 1st, to more than 9% now. But instead of discussing new restrictions Wednesday, the Premier focused on next year's vaccine, later sharing a graphic on social media that declared in big letters, Alberta will not make any vaccine mandatory, even though nobody in Canada has suggested otherwise.
I think that what we're seeing is a pattern where there's a real desire not to offend the people who don't want to wear masks, the people who don't want to get vaccines. There's this sense that personal liberty is an equal value to public health.
That path has led to disaster elsewhere, places like the U.S. that have had to use field hospitals too, which leaves Alberta in a perilous position as it inches closer to a point of no return. Heather Urix-West, Global News, Calgary.
Alberta isn't the only province struggling. In Quebec today, 1,470 new cases were reported and 30 more people died. And today, Quebec's premier backtracked on his plan to allow people to gather over Christmas. François Legault admits he never should have allowed the plan. He says it's just not safe.
I know we would all like to see our family, but it's not a good idea. The virus is very dangerous. We need to stay home and get some rest, and we have to take care of one another.
Manitoba Premier Brian Pallister came close to tears today as he begged people to follow public health restrictions over the holidays.
I'm the guy who's stealing Christmas to keep you safe, because you need to do this now. You need to do the right thing. Because next year, we'll have lots to celebrate. You don't need to like me. I hope in years to come, you might respect me for having the guts to tell you the right thing. And here's the right thing. Stay safe, protect each other, love each other, care for each other. You got so many ways to show that, but don't get together this Christmas.
Some breaking news from Toronto tonight. An elementary school there is being closed until at least Wednesday so a COVID-19 outbreak can be investigated. 3 teachers walked off the job at Thorncliffe Park Public School this morning because of an outbreak. 24 students and 2 teachers have tested positive. Last week, the school completed a pilot project to test for asymptomatic cases, and 4% of those tested came back positive. Thorncliffe Park is Canada's largest elementary school. There is a warning tonight about foreign entities suspected of spreading disinformation about COVID-19. The Canadian Security Intelligence Service has named a trio of countries, Iran, Russia, and China, in a confidential report obtained by Global News. As David Aiken reports, they appear to have a clear and sinister objective.
Stay at home, wear a mask, avoid social gatherings.
Canada's government has tried to be consistent in its COVID-19 messaging, but foreign governments hostile to Canada have quite a different message for Canadians.
It becomes an issue of how do we as Canadians learn to live with this disinformation environment while still having confidence in our democratic institutions.
The Canadian Security Intelligence Service, or CSIS, says China, Russia, and Iran have all been linked to pandemic disinformation campaigns. They've spread falsehoods about the virus and conspiracy theories, such as suggesting 5G telecom towers cause COVID-19. The objective? Increase mistrust and suspicion in Western governments and in Western public health authorities.
They're very cheap to do. It doesn't cost a lot to set up a bot army or to put out doctored photos or to spread conspiracies on a website relative to other kind of intelligence activities.
Global News obtained 170 pages of confidential threat assessments prepared by CSIS last May for the Prime Minister and all cabinet members. The records were obtained by an access to information request, and parts have been heavily blacked out by government censors. Still, the warnings were clear. Russia was actively spreading disinformation, blaming the West for the virus as part of a broader campaign to discredit the West. China is focused on a propaganda campaign that protects its own reputation and domestic legitimacy while touting its pandemic aid abroad. As for the regime in Iran, an increased disinformation campaign seeks to shift blame for domestic shortcomings in handling COVID-19 to foreign actors.
I think the most effective campaigns that are out there are ones that play on previously existing grievances.
Now, experts are divided as to how effective these disinformation campaigns are, but the concern now is that foreign actors may try to disrupt vaccination programs about to get underway here in Canada and elsewhere in the West. Donna?
Okay, David Aiken in Ottawa, thanks. The federal government has moved to fulfill a promise to enshrine the UN Declaration on the Rights of Indigenous Peoples in Canadian law.
The legislation is a significant step forward on the shared path to reconciliation for Indigenous and non-Indigenous peoples alike. It has the potential to be transformational.
If passed, Bill C-15 would require the federal government to work with First Nations, Inuit, and Métis to ensure Canadian law is in harmony with the rights and principles contained in the UN Declaration. The government would be required to create an action plan for those goals no later than 3 years after the bill receives royal assent. The National Chief of the Assembly of First Nations says that is not fast enough.
We've waited too long already. We don't want to wait for another 3 years. And before the bill is adopted into law, we also want clarity on which government department will take the lead on this crucial initiative.
Canada was one of only 4 countries to vote against the original UN declaration back in 2007, and British Columbia became the first province to enshrine the declaration just over a year ago. After a break, we take you to the U.S. Coming up, the grim predictions ahead for America's COVID-19 crisis. There is no light at the end of the COVID-19 tunnel in the U.S. right now. More than 2,800 Americans died yesterday, in one day. That is getting close to a 9/11 event every day. Hospitals are swamped, doctors and nurses exhausted, and the peak is a long way off. Jennifer Johnson reports.
U.S. medical experts predict the worst days of the COVID-19 pandemic are still to come. The Centers for Disease Control and Prevention predicts another 200,000 Americans could die from the virus in the next 2 months.
I actually believe they're going to be the most difficult time in the public health history of this nation.
With over 100,000 people in hospitals, the American Ambulance Association says its emergency system is at a breaking point. Many areas are already out of ICU beds. Los Angeles is on track to run out of hospital beds by Christmas.
It is a real possibility that healthcare workers are going to have to make choices. We're going to have to triage who gets care and who doesn't. When health systems get stressed, that's what happens.
A devastating scenario for too many hospital workers.
It's overwhelming, and we're doing the best we can.
Nursing homes have been hit the hardest, spending more money than ever trying to keep residents virus-free. Now the American Healthcare Association says the pandemic could put 70% of struggling nursing homes out of business.
There has to be a national plan strategy in order to combat what is coming down the road.
Federal officials hope COVID-19 vaccines will start rolling out in mid-December, right after the Food and Drug Administration issues its EUA, Emergency Use Authorization. Healthcare workers and nursing home residents will be the first to receive it.
We can get to them in time and give them the vaccine and help them live the rest of their lives relatively healthy.
Millions of people and businesses are facing bankruptcies and evictions. Congress is debating and inching closer to passing a $900 billion coronavirus stimulus bill.
12 million Americans are going to lose their unemployment insurance the day after Christmas. Merry Christmas.
Anxious Americans are desperate for help as the pandemic continues to crush families and the U.S. economy. Jennifer Johnson, Global News, Washington.
A couple was arrested in Hawaii after flying home from San Francisco knowing they had COVID-19. Wesley Morib and Courtney Peterson both tested positive before getting on their flight. They boarded despite being told to isolate. They were arrested on Sunday when they arrived on the island of Kauai. Missing after a mudslide. Still ahead, the search after a massive rainstorm in Alaska. This is what it looks like in Haines, Alaska today after a record-breaking rainstorm. Multiple mudslides hit the community yesterday. Roads were washed out, several houses buried. Dozens of residents had to flee. Search crews are working their way through the unstable ground looking for 2 people who are still missing. A large explosion at a wastewater treatment plant in England has killed 4 people. 3 employees and a contractor died and a 5th person was injured. The blast happened in a holding tank for treated sewage. Witnesses say the explosion was so powerful it shook the ground. It's unclear what triggered it, but police say it's not terror-related and there's no risk to the public. A big boost for Boeing today. The budget airline Ryanair wants to buy 75 more 737 MAX jets, increasing their order to a total of 210 planes. This American Airlines 737 MAX took to the skies Wednesday in a demonstration flight. Last month, the U.S. Federal Aviation Administration gave the green light for them to fly again. Airlines in the U.S. will be able to use the 737 MAX after Boeing updates critical software on each plane and pilots receive training. The 737 jets have been grounded since March 2019 after crashes in Indonesia and Ethiopia killed more than 340 people, including 18 Canadians. Transport Canada is not expecting the 737 MAX to return to commercial service before late January or early February at the earliest. It says different requirements will be in place in Canada for operators, including more flight deck and pre-flight procedures. Next, the campaign to stonewall a tunnel project under Stonehenge.
I guess this is the thing now, right?
Yep, I guess this is a thing now. Another metal monolith has appeared, this one on a mountain in California. It's about 3 meters high and has 3 sides. It's similar to the one found in the Utah desert. That one was actually there for 4 years, apparently, before anyone stumbled upon it. It has since been removed, but the mystery over who's erecting these things remains. Well, Stonehenge in the UK is one of the most recognizable sites in the world. The stone circle has stood on a plain west of London for about 5,000 years. It's a place of pilgrimage for Druids and a place of wonder for millions of tourists. So a plan to build a road underneath it has led to outrage. Crystal Gamansing on the backlash to the Stonehenge tunnel.
Stonehenge, with its collection of prehistoric monuments, is known the world over. Yet it's what could soon be under a portion of the United Nations World Heritage Site that some find astounding.
The way that he's suggested that you can put a huge road through a World Heritage Site and it doesn't cause significant damage or substantial harm seems quite incredulous to us.
Britain's Transport Secretary recently approved the project despite an independent planning inspector saying it would cause permanent, irreversible harm. The project would see a 3.2-kilometer two-lane tunnel dug under the iconic site, a move said to improve traffic flow and commerce. The UN lobbied against it, saying it would affect Stonehenge's outstanding universal value. Construction, if it goes ahead, could jeopardize the World Heritage Site's designation. The head of Highways England argues the project is an improvement.
This tunnel will remove the visibility of the road from the landscape, it will reduce vehicle noise, and it will restore Stonehenge to something like its original setting.
So they say that the tunnel will potentially enhance some aspects of the heritage site whilst still acknowledging that there will be damage to other parts. And we say that sort of offsetting isn't allowed by the international convention, so the World Heritage Convention.
Stonehenge is one of those iconic World Heritage sites, along with maybe the pyramids and the Taj Mahal. And I think we'd all be horrified if things went ahead, causing damage to those sites.
The Stonehenge Alliance formally asked the government to withdraw approval for the project, but it hasn't heard back. In the meantime, it's rallying support with an online petition. Crystal Gamansing, Global News, London.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is the winter version of Sandy Hook Pier in Sandy Hook, Manitoba. It looks a bit spooky. Apparently it gets dismantled every fall to protect it from shifting lake ice and then is reassembled in the spring. Thanks for watching. Robin Gill will be here tomorrow, and I'll see you on Saturday on The New Reality. Take care of yourselves. Bye-bye.